Joining me now, Senator Bernie Sanders, independent from Vermont, chairman of the Senate Committee on Veterans Affairs. Senator Sanders, this is something you've been working on a lot. What is your reaction to the fallout from the revelations that have been reported to the press and the president's comments today?
Well, I think a couple of things. We held a big hearing on this issue on Thursday, and if you listen to all of the veterans organizations, what they tell you, Chris, is that when veterans get into VA health care, in fact, the quality of care is quite good. And there are a number of independent studies out there which suggest that in many respects, VA health care does better than health care in the private sector. But as you have indicated, one of the serious problems that we face is that in the last several years, I think significantly because of the wars in Iraq and Afghanistan, 2 million new veterans have come into the system. And I have no doubt that there are parts of the country where we simply do not have the staff needed to accommodate these veterans in a timely and effective way. And that is a real problem. The second point that I would make is that I am glad that my Republican colleagues are now paying attention to a health care issue. But remember, these are the same folks in the House who voted to end Medicare as we know it, make devastating cuts in Medicaid, have voted 50 times to repeal the Affordable Care Act, and in states throughout this country are putting in jeopardy millions of people because they refuse to accept the Medicaid proposal in the Affordable Care Act. And
I should note some of the 5 million folks who would qualify for Medicaid expansion that's not being implemented, some tens of thousands of those themselves are veterans. But how much of this is a resource issue? You had this bill, it was $21 billion. It was filibustered by the Republicans. We've seen spending go up 38%. Is it just not enough? I mean, is this a money issue? Is this a mismanagement issue? Is this an institutional capacity issue?
You know what? I think you hit all three. I think you're absolutely right in those 3 points. Is it a money issue? Yeah, I think it is. Not only have we seen more and more people coming into the VA because they need the care and they appreciate the good care that the VA provides, but many of these cases are not easy cases. These are difficult issues. We have 200,000 men and women who have come back from Iraq and Afghanistan who are dealing with PTSD and traumatic brain injury. You have other people who are coming home without legs, without arms, losing their hearing. These are tough issues. So for a start, I think it is probably the case that while Obama has been pretty good in his budget, I think we probably need more resources, and I have advocated for that in the last several years. Second point, though, I think it is fair to say that management of VA has not been as strong as it should be. I think there are areas where the VA should have been much quicker to pick up on the problems and allocate resources.
Let me interject there for a second, because you were already seeing on the right in the conservative media basically a whole dozens of pieces today. This shows government-run healthcare can't work. This is the bankruptcy of liberalism. And obviously this thing is going to be a mismanaged bureaucracy because it's a big state enterprise. What do you say to that?
Well, look, it is no great secret that if people want to repeal the Affordable Care Act, if they want to end Medicare as we know it and convert it into a voucher program, if they want to slash Medicaid and leave millions and millions of people out on the street without any health insurance, it's fair to say these guys are not great fans of public health. I think that's a fair statement. I would argue that in many ways, and according to many studies, despite its problems, VA today provides good quality health care in a cost-effective way.
I would say to you, Senator, I hope Republicans, either in the Senate or the House, have the courage of their ideological convictions, introduce legislation to privatize the VA, and we can see how the voters feel about that. Senator Bernie Sanders, I know where you would be on that. Thank you so much.
Thank you.